So depression can be a pretty tricky disorder to deal with because some of its common symptoms like low mood, loss of interest in things we typically enjoy, low motivation, all of those things make it hard for us to engage in treatment and get started to work on our depression. Moreover, there's common beliefs in depression that make it hard for us to also engage in treatment. And in this video, I'll talk about 5 of those common beliefs and how we can start to manage them. If you're new here, hi, my name is Parky. I'm a postdoctoral fellow in clinical psychology at Stanford University, and I've been studying and practicing clinical psychology for the better part of a decade, and I'd love to share some of that information with you. So a first common belief I often hear is something along the lines of, it's not going to help anyway. And if we have the belief that nothing we do is going to improve our situation, we're not going to want to try anything new. And of course, when we don't try anything new, we can't expect anything different, and as a result, we get stuck in the depression loop. One strategy I often find helpful is to instill a level of curiosity. Yes, it's possible it's not going to help you, but maybe there's a chance if we tried something new, something different could happen. We don't know. So what are your thoughts on doing a little bit of an experiment and taking that walk anyway, or making that nice cup of tea for yourself, or spending a little bit of time with friends? Let's just see if it has any movement at all in terms of your overall mood, and we can even rate your mood before and after. So what was your mood before taking the walk, and what was your mood after the walk? And that gives us a sense to try and instill some curiosity and to see if anything actually changes from doing something new. So a second common belief I hear is, what's the point? Like, why am I doing all this anyway? I don't really see the reason why I'm doing all this work to be able to potentially get better. And honestly, in some ways they're right. If there's no particular reason why, then there's no point in thinking about the how. So oftentimes I get these patients to really think about what is truly important in their lives. What are their values? And maybe it's family, maybe it's spending time with friends, maybe it's finances or succeeding or being creative. Really understanding what is the why that then drives the how. And then by having this understanding of what is truly important to us, we can then come up with some of the motivation to be able to actually put in the hard work to get to our goals. And a third common thought I often hear in depression is, I just don't feel like it. And this is very common in depression because the literal symptoms of depression is low mood, loss of interest in things we typically enjoy, low motivation. So if we're following our feelings of depression, it's always going to take us to the bed or take us to the couch. It's never going to be something activating like taking a walk or spending time with friends. And as a result, we end up feeling even worse afterwards because we lose positive reinforcement in our lives. The things that used to give us meaning, they're being shrunken into our depression world. So one thing that I often find helpful is to recognize that behaviors can precede thought. It's not always I feel a certain way or I think a certain way, therefore I do it. We can do things and then feel a certain way or think a certain way afterwards. So it might even mean taking a walk even if we're feeling crappy. It might mean spending time with friends even if we want to feel isolated and be alone. So all of those things can be really helpful in recognizing that our behaviors can come first and then we can feel afterwards, and usually feel a lot better. So a fourth common thought I hear in depression is, it's just too much, I can't do it. And when we have depression, this makes perfect sense because even the smallest thing like getting out of bed can take a mountain's worth of effort. And as a result, we want to make sure that the goals are as small and realistic as possible to really build momentum and set our patients up for success. So oftentimes I might even say, if you can take just a 5-minute walk or a 2-minute yoga exercise, or just clean your room for 20 seconds, just starting is the biggest step, and if you can do that, then it's already a success. So we can kind of really start small and then build from there to build momentum and reduce a sense of failure and shame that can come from setting a big goal but then not being able to reach it. So in order to set yourself up for success, I might even think first of all about what your broader goals are. Maybe it's being more active or more social or to be happier, and then to ask yourself, what would it mean for me to be happier or to be more social? Maybe you'd be engaging more in your hobbies, maybe you would be spending more time with your parents, whatever that might be, and then break it down into more actionable, specific steps that are realistic for you. So maybe that means calling your parents once in the evening over the next week, or spending 10 minutes a day practicing the piano. Whatever that is for you, make sure that it is hyper realistic so that you're really setting yourself up for success, and you're also addressing any possible obstacles that could come up. So maybe you're thinking, I'm gonna do a 5-minute run after my work time. So one barrier that could happen is that if I feel super tired, I'm not gonna wanna go and I'm gonna lay on my couch. But one thing I can do is that immediately when I come home, I'm gonna put on my shoes immediately and then go out for the jog before I come back, and the gravitational pull of the lazy boy chair then takes me away to like rest land. And a fifth common thought I hear in depression is all of what Parky's saying is useless anyway, there's no point. And this is where I have a bit of a conversation surrounding the validity of a thought, whether the thought is true or not, and the utility of a thought, whether the thought is useful inherently. And oftentimes, some thoughts may or may not be true. It's possible that none of this will do anything, but the thought in and of itself of what's the point tends to be not a very helpful thought, because the function of that thought is going to make us want to hide away, do nothing, continue to feel depressed. So in this case, whether or not the thought is true is perhaps a little bit less important than whether or not it is useful. And this can be a really helpful distinction to recognize that some thoughts may be true, but ultimately they're just not helpful for me. So one strategy that can often be helpful is to ask the question, is this thought useful? And if it's not, see if you can actually just let the thought pass and let it go. And one way that can be really helpful for mindfulness-based practices is to visualize the thought as if it were a leaf on a stream or a cloud in the sky, and just let it pass away. See if you can just allow yourself to give yourself some distance from the thought, recognize that it doesn't have to be something I have to engage with, and allow it to pass on. So I know that depression can make us feel hopeless and that nothing will ever change and we'll always be stuck, but if you watch this video, I suspect that you're really giving it a good shot to make something change and you're holding on to hope. And even if you can't believe in yourself right now, I'll believe in you twice as much to make up for your share. So start small, start somewhere, and build yourself up for success. You got this. As always, thanks for watching. If you enjoyed the video, I encourage you to subscribe and also let me know in the comment section below what kind of content that you would like to learn more about in the field of clinical psychology. Until next time, take care.